Hi everyone, my name is Pete Murray. I'm a public health physician at Hunter New England Population Health, and today I'm going to give a brief health protection update focusing on COVID and pertussis. Before I get started, I'd just like to acknowledge that the lands that I'm dialing in from today are the traditional and unceded lands of Aboriginal nations. I'm dialing in from a Wawakal country, and I'd just like to pay my respects to elders past, present and emerging. So let's look at COVID first. As you'll be aware, we're currently in another COVID-19 wave, and we have high COVID activity and transmission across Hunter New England and New South Wales. And this is being driven by three factors. Firstly, the emergence of new Omicron variants, and I'll talk about those shortly. Secondly, waning immunity from previous infection or vaccination. And finally, the festive period, festive gatherings, festive events, which are conducive to COVID transmission. Let's look at some of this increasing COVID activity in more detail. This is flu tracking data for the Hunter New England area and looking at reported fever and cough rates from flu trackers. On this axis, we've got time, and on this axis, we've got fever and cough percentage. And what this graph shows clearly is the different Omicron surges and waves that we've faced. First, we've got the BA1, the BA2, the BA4-5, the mixed Omicron, the XBB wave, and our current surge. If we just go back to the middle of the year and just look at this data in more detail, you can see here we had this peak here, and then we had another peak, then it slowly tapered down. It didn't drop precipitously like earlier waves. And the reason why that was the case is because at the same time as having that COVID, that XBB surge, we also had other respiratory viruses circulating, particularly influenza and RSV. However, if we look at our current wave here, we don't have those other viruses circulating. They have dropped down to their interseasonal levels, that low level of activity, particularly for influenza and RSV. So if we're seeing fever and cough rates increasing like we have seen recently, that's being driven by this new COVID wave. Let's look at hospitalisation and ICU data for the Hunter New England area. This graph here, on this graph, got time on this axis. It goes back to the 1st of the 9th to the most recent data, which is today's data here. And we've got the number of people in hospital in the Hunter New England area with COVID-19. As you can see here, it's clearly increasing over time, and it peaked here in November with about 50 inpatients with COVID at any one time. It has tapered off, but it is on the upward trend again with the most recent data. This again is demonstrating that we've got a high level of COVID activity in our area. What about the new variants? So this graph here shows the distribution of COVID variants in our community from the 5th of August to the 2nd of December, which is our most recent data we've got available. What I'd like to draw your attention to here is these three colours here that are all increasing, and they're demonstrating the new variants that are driving this wave. This colour here is the Eris or EG.5 variant. This colour here is the Parola, the BA.2.A6 variant. And this one here that's increasing recently is the JN.1 sublineage, which is actually a sublineage of the Parola variant. And we're watching that very closely because it's increasing in activity quite quickly. Now, why are these new variants driving this new wave? And basically, the advantage they have over these other variants is that they're good at evading our immune system. Our immune system from either previous infection with COVID or also COVID vaccination. And so their advantage over these others is they are better at eluding that and evading it. Importantly, we're not seeing any severity indicators for these new variants. They're not more severe. And we're watching that very closely, and particularly looking at what's happening internationally in that space. But we're not seeing that severity indicator at the moment. What about looking forward the next few weeks to months? I think long and the short of it is the modelling is very unreliable and uncertain, and so looking months ahead is very difficult. But what it is showing us clearly is that for the next few weeks we can expect to see this moderate to high and high levels of COVID activity in Hunter New England and New South Wales. So what are our key messages around COVID this festive season? So at a high level, our general messages are to stay at home if you've got any respiratory symptoms. As I highlighted previously, we don't have a lot of other viruses circulating at the moment. So if you do have any viral respiratory symptoms, assume it's COVID. And importantly, don't go visit any high-risk settings if you've got respiratory symptoms. Other key messages are, if possible, hold your festive gatherings and events outdoors or in well-ventilated spaces. That's aiming to try and reduce the risk of COVID transmission at those events. The other aspect of our public health messaging with COVID at the moment is focusing on people who are at risk of severe disease. We've got these messages for that group. Firstly is to stay up to date with your recommended booster dose. As you can see here, this is the latest ATAGI advice, a nice summary of the advice from February 2023 booster advice and the additional COVID-19 dose September 2023 guidance. And as you can see here, it's quite complicated. And so our advice to people is to talk to their healthcare provider about their current booster recommendations. Also want to flag what's really a priority for us is this the highest risk group, which is those who are aged over 75 years of age. And it's really important, if it's been 6 months or more since your last booster dose or your last confirmed COVID infection, we strongly encourage you to go out and get another booster dose. Our other advice for the people at risk of severe COVID disease is to wear a mask indoors, particularly in areas where you can't effectively socially distance, and to have a plan in place with your GP for testing if you develop any COVID symptoms or antivirals if you develop COVID itself. Just from an updates perspective, I think it's important to note that we now have the XBB.1.5 monovalent booster available. That became available on the 11th of this month. And the key take home with respect to this booster is it's better matched for circulating variants. So the things that we're seeing and the things that we're sequencing, and I talked about previously, this booster is a better match for those. So it's going to be a better booster, and it's the preferred booster from ATAGI's perspective. The final thing I wanted to chat about was pertussis. And unfortunately, we're seeing pertussis again after a long hiatus. This graph here shows pertussis notifications in New South Wales residents by month of disease onset and age group from January 2019 to November 2023. And what you can clearly see on this graph as we move along time, you can see that we had quite a bit of pertussis activity, and that during the pandemic, when we had public health and social measures in place, pertussis activity decreased to incredibly low levels. However, what's really important to note is it's coming back again now. And a GP alert was sent out from New South Wales Health in November. It was just highlighting that we are seeing pertussis activity increasing across New South Wales, but also in the Hunter New England area. And our key messages around pertussis are, firstly, consider pertussis and order a PCR test for people with compatible symptoms and a compatible illness, even if they're fully vaccinated. And the second key message is staying up to date with recommended vaccinations, and that's so critical with pertussis, particular groups where we need to make sure we're on top of and that we're promoting vaccination of pregnant women, infants and their siblings, and adults who care for infants under the age of 6 months who have not yet received a booster in the last 10 years. And I think key people to think about in that group, new parents, new grandparents, they're key people to think about giving a booster to. And there's further information, recommendations in the Australian Immunisation Handbook. Well, that's all from me. Thank you so very much for your time. I just wanted to wish you a happy and safe festive season. Thanks so very much. Bye.